Mr. Nannon, so nice to see you again.
Yes, see you.
Mrs. Nannon, thank you for coming in today. I want to welcome you to Lewis Chiropractic. I'm so glad you could come in today. I have great news for you. We've dealt with a lot of cases like the low back pain that you've been experiencing, and we've had great results with it. So we think you're a great chiropractic candidate. So that's good news, right?
Awesome, yeah.
So yesterday I had a chance to explain to Mr. Nannon a little bit about what we do as chiropractors and how we work with the nervous system. So today I'm going to do that with you.
Okay.
If that's okay.
Yeah.
We work with the master system of the body, which is your brain and spinal cord. It's the nervous system. So as you can see on this chart, you have your brain and spinal cord, and then all these nerves that go out and affect your entire body. So you have one branch that affects how you move and what you can do, which is called the motor system. And then you also have your sensation aspect, which is touch and tingling and things like that, which is actually what you've been experiencing.
Right.
Down your leg, you said. And that's the sensory component of the nervous system. We also have a branch of the nervous system called the autonomic nervous system that comes out and affects all the organs in your body. So this upper neck region affects your salivary glands and allows you to cry. This mid-back portion affects your lungs, your heart, your stomach, those organs. And then you have this lower pelvis that affects your genitals and your digestion and things like that. So that's the nervous system. When there's any kind of, I'll show you on the spine because that's the easiest way. We have our bones here, which is your spinal, it's your vertebra. And when these bones get out of place, they can cause a disruption in the messages that get from your brain out to the rest of your body and from the rest of your body back to your brain. So it's kind of like, the best example I can think of is, did you ever go to camp when you were younger and you played the game telephone? So at the beginning of the game, you had this message that was supposed to get from the front of the line all the way to the end. And by the end, the message was never the same, right? So that one person that always messed up the message is a subluxation. So what we do as chiropractors is we adjust the spine and put it back into alignment and then make it so that that message will get from your brain to your body in the correct fashion. So with you, Mr. Nannon, what we found a lot of subluxations in this lower back region, and that's why you're experiencing this numbness and tingling down your leg, because these bones are out of place, pinching on those nerves.
Makes sense.
Yeah, so when we put those bones back in this place to the adjustment, we expect that numbness and tingling should go away, and the pain that you're experiencing as well.
Great.
So another good thing is that I noticed in your exam that you said you've had asthma for quite a few years.
Oh, yeah, since I was young.
Yeah, exactly. And we also found quite a few subluxations in this mid-back area, which, as we talked about, affects the lungs, right? So we're going to also adjust that area, and we should be able to help with that asthma as well, which is great. So I was going to tell you a little bit about what treatment we're going to give you. We're going to do a treatment 3 times per week. You're going to come in, and then we're going to do some ultrasound on you, which is a modality that will relax the muscles in your back before we adjust. Then we're going to adjust you. Then we're going to give you some exercises to do at home. I'm hoping you can keep him accountable to do these exercises. I know it can be difficult, but everything goes a lot smoother if we do those every night. And then those will strengthen your core and your abdomen and then your lower back muscles as well. And then at the beginning, like I said, we want to see you 3 times per week for 2 weeks, so that's our treatment. It's going to be about $50 an adjustment for all of those, for the modality, the adjustment, and the exercises. You can pay up front, so that would be $50 per session, like I said, so that would be $300 overall. Or you can pay each time when you come in after on your way out the door. You can pay then. So it's up to you. And then after 2 weeks, we're going to reassess and go from there. Now, I also have a patient packet for you here. So this is for you. And I'd love for you to take a look at that as well. And then I included an article about how chiropractic can help with asthma. It's a peer-reviewed article, and it gives some great evidence about how we can help with your case.
Great.
So do you have any more questions for me?
No.
I think that's it. Okay, great. Well, let's go get started.